Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Yes, indeed. This is nutritional pharmacist Jerry Hickey. I'm also the Senior Scientific Officer over here at Invite Health, and I'd like to talk to you today about a plant extract called Huperzia serrata. That's the name of the plant. The common name is Chinese club moss. It's a low-growing green plant, and they extract something from it called Huperzine A. Huperzine A is an alkaloid. When you get the correct alkaloid and you use it for the correct indication, it has a substantial benefit. For instance, when you give cocoa has the alkaloids theophylline and theobromine. They wake up the brain, they make the brain sharper. So Huperzine A is taken out of the Huperzia serrata plant, and it's a dietary supplement that helps improve brain function and memory. Now, it helps memory by protecting the nerve cells of the brain because it's an antioxidant, anti-inflammatory agent in the brain. It helps restore antioxidant levels to aging brains. This helps prevent shrinkage of brain cells and the death of brain cells. It's been used in Asia as a treatment for Alzheimer's disease and vascular dementia. Here in the United States, it's a dietary supplement to promote cognitive function. So I don't use it for patients with Alzheimer's. That's really up to the doctors and the caregivers. I use it for older people that are getting some mild memory lapses, some day-to-day memory loss, some forgetfulness, some absent-mindedness. It helps them. But I use it in conjunction with other supplements that are brain-friendly, that also decline in concentration in the brain. They're involved with a decline in memory in the brain, and their actual activities decline in the memory with brain. So what does it do? How is it restoring memory in people with some mild memory loss? It selectively inhibits an enzyme called acetylcholinesterase. Acetylcholinesterase breaks down something in the brain called acetylcholine. And in a young person, that's fine. The problem with older people is they're already losing acetylcholine, and acetylcholine is the memory neurotransmitter. So if you can block the enzyme a little bit and keep the acetylcholine around a little bit longer, it builds up, and that helps bring back memory functions to that of a much younger age. So acetylcholine does really dramatic, important things in the brain. One, you need it to repair your gray matter. Without acetylcholine, you can't hardwire the connections between your neurons so that the neural networks could become loose and break down. And it's hard to form new neural networks, and it's hard to create new memory cells. Every night when you go to sleep, basically, you release brain-derived neurotrophic factor. This is kind of like miracle grow for your brain. And what that does, it seeds the formation of new memory cells. Young people can make 700 a night about, in general. Older people make far less because they have less acetylcholine, they have less brain-derived neurotrophic factor. So when you give the Huperzine A, it helps you keep your acetylcholine around longer, which repairs your gray matter. It helps you create new memory cells because every day you lose memory cells. You have to replace them. So if you're older and you're not replacing as many, eventually there's a tipping point and memory starts to fail you. Acetylcholine also lets you solve problems, like you got off the highway at a wrong exit. How do you get back on? Which direction do you go? That's acetylcholine. But acetylcholine allows you to learn and remember. So if you want to acquire some new knowledge and remember it clearly 3 months from now, that's acetylcholine. Acetylcholine is at the core of memory. It's been shown to help older people with mild age-related forgetfulness and absent-mindedness. It's been shown to help older people with diabetes-related cognitive decline. That's important. Diabetes, all the sugar and inflammation and the poor metabolism that's going on with diabetics, they have very poor energy production. Their blood vessels stiffen, they harden, they get narrowed, so less blood is reaching the brain. Metabolism in the brain itself suffers, so they're more commonly suffering with memory decline, forgetfulness, even something called mild cognitive impairment. In mild cognitive impairment, there's shrinkage of the brain, more so than you would normally see with aging, and there's a substantial decline in memory. It's measurable. But they're not declining to the point where they're confused. So they still function. It's just hard for them to learn new things, like learning the new GPS in their new car or how to use their new cell phone, etc. It's just not happening. So they found that it helps diabetics. Diabetics are more prone to develop Parkinson's disease in their brain, vascular dementia, Alzheimer's disease, or suffer with a stroke. So it's good for their brain. A meta-analysis, in fact, a couple of meta-analysis shows that Huperzine A is helpful for patients with mild to moderate cognitive dysfunction and memory decline, diabetes-related memory dysfunction, mild Alzheimer's disease, and also with vascular dementia. There's several trials showing it helps with vascular dementia. So let's go to the research. Now, I use Huperzine A in conjunction with other nutrients. Some of these nutrients have declined in concentration or function in the aging brain, so they're restorative. And the Huperzine A helps restore the level of acetylcholine. And when you combine them, it helps people with mild memory loss, subjective memory loss, where there's a little bit of forgetfulness or absent-mindedness. So this is evidence-based complementary and alternative medicine. It's an updated meta-analysis of placebo-controlled randomized human clinical trials in patients with Alzheimer's disease and in patients with vascular dementia. So they chose 8 studies of patients with Alzheimer's disease, about 750 patients, and 2 studies of patients with vascular dementia, and they found out that Huperzine A absolutely helped them. It helped them with their mini mental state exam, that's like memory functions, and it helped them with their daily living scale. That study's seeing how well do you function every day, like do you remember to brush your teeth, can you feed yourself on your own, can you independently get out of bed and get dressed. So it was improving those scores. That's a lot to say, actually. And they found that the longer they used it, the better the efficacy, the better it worked. And there was significant improvements in cognitive function. And it was safe. It was as safe as placebo. So that's saying a lot. That's actually saying a lot. Now here's the Cochrane database of systematic reviews. It's an older review. It's 6 trials of almost 500 patients with Alzheimer's disease. And this is interesting because they found, just like the other study, at 6 weeks there was an improvement in brain function, like general cognitive function, but at 12 weeks it was even better. So they find over time that Huperzine A, at the correct dosage, safely helps restore memory in people with true memory loss. And the longer they use it, the better it works. So here's 9 human clinical trials in patients with mild cognitive impairment, Huperzine A versus placebo. Now I have to tell you, when you look at the studies, they see improvement in memory that's consistent, and it gets better and better with time. So at 6 weeks there's an improvement, which is even better at 12 weeks, which is even better at 24 weeks. That's what they're seeing in these studies. And that the Huperzine A, when used at the correct dosage, in people with memory decline, is as safe as placebo. Placebo is a fake pill. So here's a review, a meta-analysis, Huperzine A versus placebo, 9 human clinical trials in people with mild cognitive impairment. Now, mild cognitive impairment, there is substantial loss of memory, but not to the point where the patients are confused. The problem is it's like a prodromal stage before Alzheimer's, meaning that they don't have the symptoms of Alzheimer's yet, but most people with mild cognitive impairment eventually go on to develop Alzheimer's disease. So they found that there was a significant improvement in memory. It was very helpful and it was very safe in restoring memory, and as time went on, it just got better and better. Here's the last study I'm going to talk about. It's from the Journal of Alzheimer's Disease. It's research institutions in Japan, like Juntendo University in Tokyo and Kawamura Hospital in Gifu, Japan. And these are patients with dementia. and patients with mild cognitive impairment. But they mixed Huperzine A with curcumin. Curcumin's from the curry plant, the turmeric plant. And when curcumin is well absorbed, it's very good for the brain. They found that it reduces inflammation in the brain, it's an antioxidant in the brain, and it helps restore the release of brain-derived neurotrophic factor. So let me explain what that's about. That's kind of like Miracle Grow for your brain. It's fertilizer for your brain. And at night, when you release brain-derived neurotrophic factor, you reestablish the creation of memory cells. That's good because every day you lose memory cells, so you have to replace them. Otherwise, you get to a tipping point. If you don't release enough brain-derived neurotrophic factor, you don't create new memory cells every night to replace the ones you're missing. So eventually there's a tipping point where you've lost so many memory cells that it really matters, that it really means something. So they found in people with mild cognitive impairment, you give them the Huperzine A, and it's good enough to help restore brain function and help heal their brain and help the release of acetylcholine for memory functions and healing, and a release of brain-derived neurotrophic factor, especially when you marry it with a well-absorbed curcumin. It really meant something for their brain and their memory. Now, do not use Huperzine A without the doctor's recommendation, without the doctor's okay, in patients who are already getting drugs for Alzheimer's disease. And don't use it with certain high blood pressure drugs like calcium channel blockers like nifedipine, or beta-blocking drugs like atenolol and metoprolol. They don't mix well together. I recommend Huperzia serrata and Huperzine A for patients with mild age-related forgetfulness to give them a memory boost, but I do it along with other brain-healthy nutrients. I use a product called Cognition HX. So that's a call to action. If you're older and you're studying for something new, like you're taking a course in school, or you just need a little bit of a boost for your day-to-day memory, try the Cognition HX. It also helps people with mild cognitive impairment. They have measurable memory loss, but not to the point where it's truly substantive. Now, thank you for tuning into the Invite Health podcast. Before I go, let me give you an email address in case you have any questions about this episode or what else you could do for your memory or whatever your health consideration is. Is there a nutrient, an herb, a vitamin, a mineral that might help you? Here's the email address. It's connected to 5 of the Invite nutritionists. nutrition@invitehealth.com. nutrition@invitehealth.com. So thanks for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or you could visit invitehealth.com/podcast. Please subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. I hope to see you next time on another episode of the Invite Health podcast, and thank you so much for listening.